Hi guys, welcome to Health Talks. I'm Laura Termini, founder of Chickenol.com, natural, organic, and Latina. And I'm at Miami U Health Facility. Let's talk women's health is the topic today. So let's talk, ladies. Here's the thing. Many of those symptoms we're embarrassed to ask about can be treated, but we have to talk about them. Welcome to Chicano Live Health Talks with You Miami Health. And let me introduce my guest today, Dr. Laura Martin. Laura is an obstetrician gynecologist at the University of Miami Health System. She received her medical degree from Nova Southeast University College of Osteopathic Medicine and has been in practice between 6 to 10 years. Oh my God, that's a lot of time. Dr. Laura, welcome to Health.
Thank you so much. Thank you for
Laura or
having me
Laura?
today.
I can say. Yeah. Well, this is the most common, women's health topics. I've been doing some research, a Google search, and I have some things that I want to read to you.
Absolutely.
People search on Google include yeast infections, urinary tract infections, PMS, vaginal odor, and there's this topic of bacterial, vaginal itching, sexually transmitted infections. So the list is endless. So let's talk about when it comes to women's health, and we have some questions. Which questions are patients more embarrassed to ask you about?
Well, I think that patients are most embarrassed to ask me about their sexual health because there is so much social stigma surrounding our ideas about sex and what's right and what's wrong about sex. But when you're going to your healthcare provider, it's important to know that they care about you and your health. And we're coming from that perspective. So it's completely okay to talk about these issues and ideas that you may have or questions that you may have with your doctor. And then the other thing that I hear commonly that people are very embarrassed about are any urinary issues. So I specialize in urogynecology, and with these conditions, patients may be leaking, urinating on themselves, which can be very socially embarrassing. It kind of takes them back to a time before they were out of diapers, which can be embarrassing for adults. So those are also issues that we discuss that can be embarrassing for patients.
Do you think they're embarrassed because they're older, or do you see this on older generations or younger? Because I would think, like now with social media, which I love social media, everything is more like normal to talk about, like urinary infections. They're all over. The word vagina is all over. All the influencers on Instagram. It is an older generation who's still afraid to talk about that, or you see. At any age.
I definitely see it across the board. I think it really depends on your exposure to, medicine. If you have any of that background, then some people are a little bit more comfortable, but still, people across ages tend to be a little more uncomfortable with these issues.
Okay, let's talk about sex and intimacy. What are the questions that your patients are asking?
So a lot of my patients will ask me about why they might have pain during intercourse. Or why they might have bleeding after intercourse. Those are two big questions. And some patients are getting infections after intercourse as well. So those are all things that I discuss regularly with my patients.
And what about contraception?
As far as contraception, there's a lot out there. We have a lot of options. We're very lucky in this day and age.
Yes.
That we're able to control our reproductive health. And, there's things across the board. There's a pill that you can take every day, but if you're not good at taking a pill every day, there are long-term contraceptives that you can use that last from 3 to 5 years, one even up to 10 years. So there's a lot of options out there. We even have one form of birth control, which is called an IUD, a copper IUD that doesn't have hormones, if you would like to stay away from hormones as well. And then there are other things.
What about the shot? I've heard about the shot.
So there is also a shot, and you can get that every 12 weeks.
Oh.
And that's called Depo-Provera. And that is also a long-acting form of birth control, but you do have to remember to go back and get your shot every 12 weeks for that one.
I know that each patient is different, but what do you prefer? Like the pill or the shot? Or I heard that there's some patches as well.
So there are pills, there are patches, there are shots. There's the IUD, which is an intrauterine device, goes inside the uterus.
Okay.
There's an implant that goes in the arm, and then there's also surgeries like a tubal ligation and also a vasectomy for a male. So for my preference, vasectomy is shown to be the safest form of birth control. So if you're done childbearing.
If men want to do it.
If men want to do it.
But most of them, they won't. They won't do it.
Some of them will, but it's something to consider.
Okay.
And then aside from that, I think the longer acting birth controls are better, but it's always up to the patient. So whatever you're comfortable with is what I'm comfortable with, as long as you don't have any contraindications.
Do you think it's still a taboo? Because I've been having conversations with different, friends, and when it comes to contraception and their partners still want to have kids, sometimes they go to the doctor and their partners don't know that they're taking contraception.
Sure.
Have you seen that?
I haven't seen that per se, but I've certainly seen issues with sexually transmitted diseases and issues stemming from that with couples.
That was my second question about that.
Yeah, so that does happen. And unfortunately, we can't tell you, why your partner has, had an intimate relationship with somebody else, but that's certainly a conversation that you need to have with them, and you need to be as open and honest as you possibly can with your partner.
So you mean when you are with somebody and you have a long-term relationship and you never had a sexual disease, and then all of a sudden you have, so you're going to think he had sex with somebody else, right?
Yeah, so that's very...
Or you.
Right, so if you have a bacterial infection such as gonorrhea or chlamydia or syphilis, then those types of infections are more likely to have come from somewhere else. But things like HPV and herpes, they can be around for a long time, and you just happen to find it on your exam. So that's a little bit trickier as far as...
Don't tell me that. I'm running to my doctor tomorrow. Let's see. I want to talk about, the vagina monologues. It was a very famous theater play. Do you remember? And let's question that you shouldn't be too embarrassed to ask to your doctor. For example, now that you were talking about urinary problems, the Kegel balls now are very famous because they have now a device. I bought it. I bought it for me, even though I don't have kids. They are kind of like an electronic thing that you can control with your app. So technology is going ahead with women's health as well.
Yeah, that's great.
What do you like those kind of devices?
I think they're great. I'm always a fan of holistic and conservative measures first before going into things like surgery and medications. And so I think doing your Kegels and using these devices to see how well you're doing your Kegels are very helpful, and I think it's excellent.
Perfect. I have some questions about, from Chicano readers that were sent to me on a private DM because they didn't want me to, to say their names.
Sure.
Can having sex give me a yeast infection?
So generally, having sex does not give you a yeast infection. However, just anecdotally, I've found that some patients with certain partners end up getting a yeast infection after having intercourse with that particular partner. It may not have happened with other people, but with this person it does. So I've seen that happen before. But usually that does not happen. Now, it can cause bacterial vaginosis. So, just making sure to stay clean, not washing inside the vagina, and eating healthy, eating some probiotics can help with those things.
I remember when I was younger, I used to do what's the name of the cleaning things that you do?
The douching?
The douching, and I remember going to my doctor, and my doctor said, Laura, stop that.
Yeah.
It messes with your pH, so it's not good for you. I never used them again, and I was healthier. I was feeling better because I used to have a lot of yeast infections, and I thought because I was just cleaning my vagina, too often.
Yeah.
So, but it was something that I never thought about it because every time that you go to a pharmacy, they try to push the products.
Right. Well, the douches are not good because they actually wash away the healthy bacteria that live in the vagina, and then that causes the imbalance, and it causes a bad odor, and nobody wants to have a bad odor.
Oh. What about the perfumes and now they have a spray that you spray to I don't know why people want their vaginas to smell like flowers. I don't know why, but what about those products?
So generally, I tell people to use things that are hypoallergenic. Use very light soaps to wash the vaginal area. Some people are even so sensitive they can only use water to wash the vaginal area. But you don't want to use anything that's too heavy in perfumes.
Exactly.
You also want to allow the area to air out. So I tell people not to wear any underwear at nighttime while they're sleeping, and also to wear cotton underwear during the day. No panty liners, those types of
No
things.
panty liners. Okay. Another question. Why do I have pain during sex? That's a common question.
Yeah. So this could be multifaceted for different people. So different people can have different reasons for having pain during intercourse. It could be that you have tight muscles in the pelvic floor. It could be that you have thin tissue on the entrance of the vagina that tears when you have intercourse. It could just be the position, and it just is an uncomfortable position for you, and you need to try different things to make it better.
Will taking antidepressants affect the pill?
Taking antidepressants does not affect the pill, so that's okay. You can take things like OCPs and Prozac together. However, anti-seizure medications do affect the pill, so that you would want to talk to your doctor about.
Okay, I have a question about, oh my God, I forgot. Now that I was thinking about my own stuff, I have another question here. I'm 30. Is it too late for me to get an HPV vaccine?
So at the age of 30, you can still get the HPV vaccine. It's up to the age of 45 now, which is great, because there's still women out there who are single and would be at risk for being exposed to that virus. So up to the age of 45 now, it's recommended.
45. Oh, wow. I like that. I have some notes here that I did, doctor. Like every time that I go to a doctor, because when you as a patient are seated with a doctor, you always forget everything. So some notes for you guys. Write a note at home that describes your problem and take it to your appointment.
Yes, I always tell my patients that, especially because a lot of my patients are older. It's always good to write it down, because even if you get through, a majority of your questions, you're always going to say, oh, I forgot. And then your next appointment is probably in a year from that time. So just write down all of your questions. We never mind reviewing anything that you have for us.
Find out if your doctor is available via email or messaging through now apps. There's popular ads. Send your concern electronically before your appointment. So is that something that you see is common with you?
Yes, I do try to have my patients go through UChart. Everything's documented within the medical chart, so it's all HIPAA protected. And then I'm able to communicate directly with my patients through that. So it's a really nice feature.
If you feel more comfortable talking to a nurse or other member of your team, ask of those members to make a note of your concern. So when you go, if I want to go with you, do you have somebody to take care of me before you? Like most of the doctors?
Yes, so when you come into the office, you check in, and then the nurse will bring you in. They'll bring you to the bathroom, and then they'll talk to you about why you're here today and make sure that all of your information is in the system. If there's anything that you specifically want to talk about, you can always let the nurse know, and they'll tell me. But I also speak directly to the patients and give them plenty of time.
Yes. Is there anything else that you want to add to the conversations about women's health?
Yeah, I think that it's just really important to let your guard down in that moment with your physician, because they're there to take care of you, and there's no reason to be ashamed.
Yes. On that note, see you on our next health talk. I'm going to share with you all the info about the doctor so you can make your appointment. That's why we're here sharing this kind of conversation every month, so you can have these amazing doctors, and you can ask your questions. Don't look on Google, don't go online, because even though we have blogs and we have the information, it's better to have it straight from the doctors. Thank you so much, Laura, for your time. I know it's your lunchtime, but we're going to be sharing this. And as I always said, if you like this video, please share it, share the love, share the community. This is the only way we have to really share our community with new followers. Thank you so much. This was Health Talks.
Thank you.
Thank you. Bye-bye. Bye.
Bye.